This is the Solis Foundation Research Training Initiative. My name is Dr. Fenmata Chite, and I'm going to take you through the basics of research ethics. Introduction. Ethical principles are the ones that govern the way we conduct research. Ethical considerations are therefore very important when conducting research involving human participants. Researchers must ensure the protection of individual rights, minimize potential harm, and uphold the principles of informed consent, privacy, and justice. But the practical steps that help us maintain privacy and confidentiality may vary depending on the research context and methodology of the study. The principles, however, remain the same: respect for participants and diligent protection of their information. Maintaining privacy in research primarily revolves around respecting participants' rights over their own information. The Hippocratic Oath is attributed to the Greek physician around 400 BC. It is widely regarded as the earliest articulation of medical ethics. This oath emphasizes fundamental ethical principles that continue to resonate in the practice of medicine to this day. Amongst these principles is the concept of non-maleficence, which emphasizes that healthcare practitioners should prioritize the avoidance of harm to their patients. The oath is also an acknowledgement of the significant influence physicians have over the well-being of their patients. This recognizes the inherent vulnerability of individuals in their reliance on medical professionals and underscores the profound moral responsibility that accompanies the practice of medicine. The ethical weight and the professional obligation thus demands that physicians operate with unwavering integrity and profound consideration of the impact of their actions on the lives and the bodies of patients. Many unethical research activities took place between 1920 and 1950, leading to significant changes in research ethics that changed the way research is conducted globally. This period saw incidents such as the U.S. Public Service studies in Guatemala and the 40 years Tuskegee syphilis studies that went on for years without notice. There was also instance of unethical research activities during World War II, including the inhuman experimentation by Japanese soldiers on prisoners of war and the Nazi experiments in concentration camps. Henry Beecher, a Harvard physician, played a crucial role almost 2 millennia after the Hippocratic Oath by exposing some ethical breaches in human subject research. In his articles, which was published in 1966, along with other significant milestones, formed the basis of bioethics. The Nuremberg Code of 1947 was a set of principles highlighting acceptable human experimentation with which to adjudicate the guilt of the Nazi physicians. The code highlighted principles like informed consent and the freedom from coercion. The Declaration of Helsinki followed suit. Henry K. Beecher's 1966 article, Ethics and Clinical Research, is a landmark article, often called the Beecher's bombshell. He described 22 examples of clinical research which he deemed questionable. More and more discussions on ethical research followed suit, leading to the formation of ethical guidelines for research. The term bioethics have been debated over and over again regarding its origin, with various sources attributing its first usage to different individuals. But more important than that was the debate on the focus and how the concept and the scope narrowness should be defined. While some advocated for a narrow definition, concentrating on ethical issues in medical settings, others supported a broader definition that encompasses factors like poverty, racism, social justice, and access to healthcare. Following these discussions were the formation of the think tanks. Their primary mission was to deliberate on bioethics and issues surrounding this. The most prominent amongst these think tanks was the Hastings Center and the Kennedy Institute of Ethics, which was founded in 1971. These think tanks began publishing articles on bioethical topics, which laid the groundwork for much of the future of academic bioethics. The journals from these think tanks are still prestigious publications in bioethics today. Bioethics was not initially regarded as a field of its own. It emerged in other fields as complementary subjects. Today, over 50 universities offer master's degree programs in bioethics, with a handful of the universities offering doctoral degrees in bioethics. Bioethics is one of the most prominent examples of interdisciplinary or multidisciplinary field. The Government Bioethics Commission was set in 1974. The first National Commission was formed by Congress and tasked primarily with formulating guidelines to govern human subject research. This gave birth to the Belmont Report, a document that outlined the basic principles that should inform the conduct of research. These guidelines were written to protect the human subjects from unethical research. It highlighted respect for persons, indicating that individuals should be treated as autonomous agents and that they can make decisions on their own. Persons with diminished autonomy are entitled to protection. It highlighted beneficence as not doing any harm and maximizing benefits while minimizing risk. It ensured that justice was served through equal distribution of burdens and benefits, and each person had equal share, that each person according to the individual needs, efforts, and societal contributions. Bioethics is the science that governs the moral principles that govern research and forms the intersection between disciplines such as medicine, technology, and the social sciences. The addition of bioethics into education, the workforce, and culture has infused professionals with more humanity and humility. Professionals must learn and discover all that they can with all that they have to improve and save lives, but they should all keep in mind the moral issues that guide their practice. Ethical frameworks are the lenses through which we look at the moral issues governing research. One of the most famous amongst which is principalism. This highlights that a person's duty can be derived from a set of ethical principles. Each principle captures something of ethical importance, whether it's autonomy, beneficence, non-maleficence, or justice. The Belmont Report, written by the National Commission for the Protection of Human Subjects of Medical and Behavioral Research in 1979, collapsed beneficence and non-maleficence into one principle, meaning benefits of research should be maximized, risk should be minimized, and that no harm should come to the patient. The principle of autonomy or respect for persons can be said to be foundational amongst the four. In clinical research, informed consent is essential for the ethical practice. It emphasizes providing participants with comprehensive information so that they can make informed choices. This includes details about the study, who is funding the study, associated risk and harm, the benefits of participation, and the participant right of participating or not. They should be made to understand that they always have the right and the upper hand to participate or make a decision not to participate. For informed consent to be complete, valid, and meaningful, it must meet four key criteria. Information should be disclosed to the participants should be competent enough to make the decision, there should be understanding or comprehension of the information that has been disclosed, and there should be voluntariness, meaning participants should not be coerced or threatened to be part of the study. So providing clear information to potential participants allows them to make rational and informed decisions about their participation. However, if the informed consent process or form is very complex, it can hinder understanding. To address this, there is a universal rule that the consent form should be simple enough for the participant to understand. In developing countries with limited access to resources, poor infrastructure, and high illiteracy rates, challenges related to competence, comprehension, and voluntariness often arise. These difficulties can be attributed to limited understanding of clinical trial risk, concerns about the study procedures, and fears of reduced access to medical care if they refuse to participate in the research. So the ability for an individual to make decisions is competence, and it depends heavily on whether they understand relevant information that has been given and the consequences of either participating or not participating in the research. Factors such as age, sex, disease severity, cognitive disabilities, particularly in elderly populations and those with mental disorders, can influence a patient's decision-making capacity. Putting all this in mind, voluntary informed consent should be sought before the onset of data collection. Information about what data you're collecting, where you're collecting it, how long you would store it, and how you plan to use it should be communicated to the research participants. Research participants have rights, and their rights should be known to them. They have the right to be informed, the right to have access to their data, the right to restrict data processing on the part of the researcher, the right to data portability, the right to object and withdraw from the research at any point in time. So consent should be ongoing. It should be continuous. It is not a one-time thing if it's a clinical research or a clinical trial, to be more precise. For many years, privacy and confidentiality has been used interchangeably. While privacy is about people and the information they share about themselves, confidentiality is an ethical duty that prevents the sharing of data to a third party without consent. When researchers respect participants' privacy, they acknowledge participants' right to control their personal information. When researchers respect confidentiality, they ensure that the data that has been shared with them is safe and secure. Privacy and maintaining privacy is essential before and during data collection. Participants should feel safe and secure to share their data. Confidentiality is more important during and after data collection. So data should be kept only as long as needed, and it should be kept in a secure setting. And access should be restricted to only people that are necessary. To ensure both privacy and confidentiality are maintained in the study, minimize data collection to only what you will need for your research. Remove or hide personal identifiers as early as possible in your data processing by coding personal identifying information. Confidentiality agreements should be had between team members. Who has access to the data? Who can it be shared with? How long should the data be kept? Data handling and storage with strong passwords such as encryption should be used. Limit data access and store all physical data in a secure location. Ethical review processes can also ensure the appropriateness of the study to ensure that there is respect for persons, privacy is maintained, and confidentiality. Principles of beneficence and non-maleficence were combined by the Belmont Report. Research must be designed to maximize benefits and minimize risk. First, do no harm, and second, maximize possible benefits. All medical research has risk and burdens, but the potential benefits should outweigh the risk and the burdens of the research to the research subject. When risks outweigh benefits, research should be modified or discontinued. Predictable risk and burden should be compared with foreseeable benefits. Measures to minimize risk must be implemented, and risk must be continuously monitored, assessed, and documented by the researcher. Adequate risk management should be put in place. The principles of minimizing risk and maximizing benefits therefore work hand in hand, and this can be done through four main ways. Risk assessment, which will mitigate potential physical, psychological, and social harm. Favorable risk-benefit ratio, the benefits should outweigh the risk and the risk should be minimized as much as possible. Equitable subject selection, fair and non-discriminatory selection, avoiding bias or exploitation. Ongoing monitoring, continuously monitoring the research process and making adjustments to protect the safety and well-being of the research participants. The principle of justice talks about fairness. Vulnerability increases the likelihood of injustice. Selection of research participants must be fair and equitable. Vulnerable groups should not be exploited, and the benefits and the burdens of the research must be distributed justly. The people that participate in the research are supposed to get part of the benefits. So participants are not supposed to carry only the burdens of the research and not get any of the benefits. Those that carry the burden should benefit from the benefits of the research. Vulnerable groups and individuals should receive protection. Medical research with vulnerable groups is only justified if the research is responsive to the health needs or priorities of this group. Therefore, if research can be done in a non-vulnerable group, it's preferred. Certain research participants, such as children, elderly, prisoners, those with mental or physical disabilities, are considered vulnerable and require special protection. Researchers must take extra precaution to ensure these individuals are not exploited or coerced into participating into the research. Those that carry the risk should share in the benefits in terms of knowledge that is generated from the research, practices that have been made from the research, and interventions that resulted from the research. Conducting ethical research is of paramount importance. It contributes to the greater body of ethical research practices, ensures the collection of valid data, builds trust between participants and researchers, enhances community trust, ensures that honest data is collected, minimizes stigma and stress, protects participants' autonomy and dignity, ensures that participants have the right to control their personal information, facilitate participant willingness to participate, all of which ensure both respect for participants, privacy, and dignity. Research participants are supposed to be protected, and no harm should come to them if it can be avoided through the participation in research. Ethical research to be possible, there should be ethical conduct of researchers. Ethical conduct of researchers is possible through maintaining the highest standards of honesty, integrity from data collection to reporting of findings. Researchers are responsible for the ethical conduct of their research and must be willing to take full responsibility. Adherence to the established ethical principles such as autonomy, non-maleficence, beneficence, and justice throughout the research process. So honesty, accountability, and adherence to the ethical principles goes a long way in ensuring that research is ethical. Institutional review boards, also known as research ethics committees, are the custodians of ethical research. They approve, disapprove, or suggest modifications to ensure that research proposals meet ethical standards before they are initiated. This is to protect the rights and the welfare of human participants. They work closely with researchers to address ethical concerns, ensure that risks are minimized, benefits are maximized, and ensure the appropriateness of the study before they start it. So they serve as regulatory bodies, ensuring that proposals meet the required ethical standards, meaning autonomy, beneficence, non-maleficence, and justice are included and ensure that they are not violated before the study is initiated. Ethical issues can be complicated. Managing them are not always straightforward. Sometimes ethical principles get in the way of each other. Autonomy can stand in the way of justice, and likewise, justice can stand in the way of either beneficence or non-beneficence. Each principle and its circumstance has to be looked in its unique circumstances to make a proper and sound ethical decision. Research ethics committees, researchers, and community members, especially vulnerable communities, perspective has to be put into place before a sound ethical judgment can be made. Sometimes religion, sociocultural issues, socioeconomic status can all influence the community's perspective of which ethical principle is more important to them. Navigating these challenges are not always easy, and then trade-offs have to be made at times, but which one would precede or supersede or be regarded above the other principle has to be made after proper deliberation to reconcile the principles. Upholding ethical principles in human research is crucial in protecting participants' rights. It minimizes risk and maintains public trust. Medical research involving human subjects must be conducted only by individuals with the appropriate ethics and scientific education, training, and qualification. Confidentiality and privacy of research participants must be maintained. Information should not be hidden from participants to avoid dropout rates. The Research Ethics Committee members are the defense attorneys of research participants in ensuring that their rights are not violated. They are also the judges of the research process by ensuring that researchers take full responsibility for their research. Ethics committee members should be trained to ensure that they are better able to protect the rights of research participants.